Hi, I'm Jennifer Oja. I'm a family medicine physician assistant at Grand Itasca. I see a variety of different patients at Grand Itasca. I see anywhere from young children to adults to elderly patients. There are several ways you can protect your child from the sun. Sunscreen is really optimal to use when you're out in the sun. Hats is really a good idea. That helps protect against the head and the face against the sun. Also, trying to wear sunglasses that have UV protection is a really good idea. And then, of course, wearing nice clothing that protects the skin. I usually recommend using sunscreen that has SPF 30 and above. Lotions or sprays are really good as far as protecting your children against the sun. Lotions are a little bit easier, especially for children, because then you're not breathing it in as much as compared to like a spray. Especially children, they're very wiggly when you're trying to put on sunscreen, so sometimes lotion can be a little bit better when you're applying them on children. I usually recommend applying sunscreen at least every 2 hours when you're out in the sun. Try and put it on about 15 minutes before going out in the sun. And then when you're out in the sun, try and put it on at least every 2 hours just to keep on reapplying it. And of course, out in Minnesota, we have a lot of lakes, a lot of different water activities. So especially when you get out of the water, definitely trying to put on sunscreen as soon as you get out of the water is really a good idea. The sun is really the greatest between 10 a.m. and 4 p.m. So if you can choose to go out in the sun, try and go either earlier in the morning or either later in the afternoon or evening, just so you're not getting those harsh rays. So if your child gets a sunburn, definitely getting them out of the sun as soon as possible is really important. Cool washcloths can be helpful, especially if they're really uncomfortable. Tylenol, ibuprofen, that can definitely be very helpful because definitely a sunburn is really uncomfortable. Aloe vera gel is really a good idea because that really is a cooling gel for the skin, so it can be helpful as far as calming down the sunburn. With being in Minnesota, we have a lot of lakes and a lot of different water activities. So in order to ensure the water safety of your child, I definitely recommend really be cautious as far as monitoring them constantly when they're around water. Unfortunately, drowning is the leading cause of death for children. And so it's really important to be cautious with children when they're around the water. Definitely trying to do swimming lessons is a really good idea, especially for children, even at a very young age. Starting them at as young as the age of 1 is a really good idea, just to get them comfortable with water and just really get introduced to water. So life jackets are very important for your children, especially when they're in a boat, pontoons, any type of water activities. You need to always have a life jacket on your children. And even if you're on the beach, for example, it's not a bad idea to have a life jacket on them as well too. In case of an emergency, if you accidentally do find a child that is in the water, the biggest thing is to get them out of the water as soon as you can. Survival for that child is really based on speed at that point, so you really need to get them out of the water as soon as possible. And then, of course, the next best thing is to really be on the phone to call 911. If you know how to start CPR, really good idea to start that as soon as you can. But if you don't know how to do CPR, there's the emergency responder on the phone, and they can walk with you through any of those emergency type of scenarios. So they will be able to walk with you and let you know what you need to do in order to help that child survive. Grand Itasca Clinic and Hospital, your partner in health.